welcome back to Enigmatic Entertainment, and this is pretty much going to be the fourth in my series, which is called, living with. I did living with depression, living with anxiety, and I also did living with scoliosis. I forgot which order I did them in, but those are the three I have so far. And I've been thinking lately that I wanted to add a fourth one to it. It's been a while since I did them, probably a year or more, but it seems about right. That new topic is living with chronic pain. So pretty much chronic pain can be something that's described as obviously pain that is not, it's not something that's just maybe like once a month or once every 2 weeks or probably even once a week. Chronic pain is pain pretty much that you get frequently, almost a regular basis, pretty much, like a few times a week, more than about half the month, like 15, 14 days, 2 weeks out of the whole month, around there. So it's something that I've been suffering with for a few years now, to be honest. It's just something I guess, grown accustomed to. I mean, then again, how can you really just get used to dealing with pain in an almost everyday basis? So you just deal with it the best you can, and live your life within your limitations, physically, mentally, and emotionally. So I didn't really touch on it too much when I talked about living with scoliosis, because that was more really exactly how scoliosis itself affects me. And the chronic pain is something that's not just going to cover scoliosis. It's going to cover pretty much pain from anything. And for me, that includes headaches, both migraine and tension. On a very pretty, I want to say regular, but I don't know any exact reasons that cause it, and it's not every day, but sometimes I'll get them for 3 or 4 days in a row. Sometimes I won't get it for a week or two, but it's still, that's just one part of the umbrella that we call chronic pain and my own symptoms of it. So another example, of course, is the lower back pain, which I get, which probably has something to do with my scoliosis, which is the curvature of the spine. If you've seen the previous videos, then you'd already know everything about that. But I get pain in a whole lot of places, and I try my best to put on a smile sometimes, and laugh about things, and try to keep my best hopes up. But it's not always simple. To be honest, right now I'm in pain. Might not be easy to tell, because once again I'm trying to block it out of my mind, because it's not too bad right now, but you could tell probably that I'm fidgeting and whatnot. And it's not always nerves. It's really a lot of times just discomfort from dealing with the pain and trying to focus on what it is I'm saying. As you can see, I probably sound like I'm getting sidetracked. Hey, that's part of the problem, process, pain. So anyways, chronic pain, or CP as some people who deal with it call it, it's nothing simple. For one, you have to find out what it's coming from, which itself is a problem. 2, you have to find out how to solve it or get rid of it, lower it as much as possible in order to still function. For me, in my case, I haven't found out the reason really exactly for most of my pains, because sometimes I get joint pain. I don't know what it's from. I do have other underlying conditions that might have something to do with it. I'm not really sure. And for other people, they probably, as I do, speak to doctors, get tests done. I've lived a life where I've had to get lots of medical examinations. I've seen many doctors and specialists, ranging from neurologists, that is a specialist for the kidney, and urologist, which is a specialist for the urinal area. You know, don't know exactly what term to use, but yeah, you know. Cardiologist for specialist for the heart, which I've seen when I was younger because of the chest pain I was getting pretty frequently, which was ruled out to not be for the heart, coming from the heart. So I was relieved because I was quite young for that to be happening to me, and it still happens now, but my heart is fine. So you know, that's just take a sigh of relief for that. So and then the medical doctor, I see him more often now than I would like. No offense, but you know, no one really wants to have to go to the doctor often because that means it's a problem. Another specialist, podiatrist, doctor for the foot, because I have problems in the knees and the leg area, in the feet and everything. I've you know, had problems. I've even fractured one of my toes, I believe, before, and things of that nature, and pretty much chronic knee pain and everything like that. Tried to find out what that's from. So with all these things combined, it's been I've lived and had my fair share of doctor's appointments, visits, and have not had much support besides that from my family. Mostly my parents, of course. They've been with me almost every step of the way, and that's something I've always been, you know, glad about, because I understand that not everyone has that same, you know, I don't want anyone to be in that situation, of course, to have to be seeing doctors on an almost regular basis and be going through pain. But, you know, some people don't even have their parents to go through it with them, or family members or loved ones, and that's even worse, I can imagine. But really, a lot of people don't understand CP. You know, they can't relate because they don't go through it. They might injure themselves or something, and they get right back on their feet and recover very quickly, and they never really experience anything too bad again, you know, until something else might come along, but it's nothing chronic, which means that, you know, it's recurring. It's, once again, like I spoke in the beginning of it, it's not something that's just acute, you know, just short period of time, or comes and goes, or, you know, not very frequent. So I pretty much get pain to the point where I might be bedridden for a little while. Just, you know, thankfully I've not really have to been hospitalized or anything, but there are times where it is quite painful to do the things I like to do. I have had to cut back on some things, like going for long walks around the neighborhood, and, you know, things like that. I've had to pretty much quit working because any job that I could find always revolved around me having to stand up on my feet for hours at a time with very little to no breaks in between. And for someone with my pain, that's not really something that you can do, at least not on a regular basis. So it leaves me with options of what, really? I mean, I've thought about it, and, you know, it's heartbreaking, and it's something that no one wants to go through themselves, and they don't want to see their offspring go through. I've talked to my parents about it, and they have quite often mentioned that they feel for me and everything like that. So what the freaking, and it's not easy to deal with, basically. So it's like, what do you really do? Do you just deal with your pain and do you find a solution? Or do you just, you know, do you give up? I mean, some people go through the pain to the point where they actually commit suicide, and I think it's horrible. Like I said, no one should have to go through that. That's plain and simple. Especially when it's something like a birth defect, or something that's just happened by like a freak accident, nothing that you've caused on your own free will, you know, like your own volition. You didn't just decide to injure yourself or get into a fight and, you know, like, be reckless. When it's something that's unexplained, like my own conditions are either pretty much unexplained as to why they happened, or they've been what you would call birth defects, basically. So it's really it's an unfortunate thing. It's something it's not the easiest thing to really talk about, especially to you know, I'm gonna call them outsiders, you know, and by that I just mean anyone who doesn't have to deal with a whole lot of, you know, pain on a physical level, at least not on a regular basis, of course. So really, it really comes down to it, like what is there to really do? But you know, once again, like, you know, thanks for listening, and I'm just gonna leave it there because I really don't want to, you know, delve any deeper into it at this moment. Maybe I can speak more about it at a later point in time, and maybe I'll continue the Living With series. So, you know, which is where I just give a little insight on things that I deal with in my own life that I'm sure other people can relate to, like physical, medical, you know, mental conditions, disorders, and whatnot, and just life itself. So once again, thanks for watching. I hope you enjoyed, and also, you know, follow the channel on Twitter. It's ENIGMATIC_ENT. That's Enigmatic_ENT, short for entertainment. Same name as the channel. So yeah, I don't normally plug my Twitter in the video, but you know, I figured just check it out. I leave updates on it every so often, and I'm thinking about opening up another like social media page for it, because me personally, I'm not really a social media person, but I do have it just for keeping people updated with the channel, you know. And as always, stay tuned for more. Feel free to like the video if you'd like it, and to comment if you can relate, or you know, you have any questions or anything, and I'll definitely get back to them. And that's all. So thanks for watching.